guys? Dr. Jade Rainbolt here, and today I'm going over SI pain. So your SI joint is located right about here. So if you're getting pain with your SI joint, it's likely located right here. You can pinpoint exactly where it's at. So your SI joint is where your sacrum meets your ilium, so basically where your spine hooks to your pelvis. So it works as a shock absorber whenever we plant our foot down. It transmits the energy to our body. What can cause SI joint pain? There are lots of things that can cause it. So this can be caused from a trauma if you land quickly onto one leg, like say you're tripping off of a curb and you land real sharply onto that one leg. It can be from a fall, just falling down. It can be from pregnancy. Whenever we're pregnant, we release extra elastin and it causes our joints to be a little bit more mobile to help with the child delivery, but it can also cause pain in this area. It can be from abnormal walking patterns. This joint is supported by many ligaments and muscles, so if there's an imbalance in the muscles on one side of the hip or leg than the other, it can cause you to walk a little bit abnormally and cause uneven forces going through your limbs. That can cause SI pain. It can be from sitting for too long. It can be from standing on one leg and just shifting your weight on one side for a longer period of time versus standing equally weight distributed on both legs. So there are lots of things that can cause SI pain, but what you guys probably want to know is, how do I get rid of it? This is why you came to my video. Let's get that pain down. So ultimately, I'm going to give you guys a handful of stretches and exercises that I see help a lot in the clinic whenever I implement them with my patients. Ultimately, everybody is a little bit different. We have different imbalances in our muscles. So it is best to go seek out your local DPT, doctor of physical therapy, to get properly assessed. But here are the stretches and exercises that I tend to find do really well with patients who have SI pain. So going into that, we're going to go over these stretches first. And what you're going to do is go ahead and lay back, and you're going to go onto your back, and we're going to start with a glute stretch. And what you're going to do is bring one knee up to your belly, so this is single knee to chest, and you're going to hold like that. And you're going to feel a pull through your glutes, aka your butt muscles, and you're going to hold this for 30 seconds. So you want to hold your stretches for at least 30 seconds for them to be effective. If you do it for less, it doesn't give the tissues enough time to elongate and stretch, and they'll just go right back to how they were, and we don't want that. So you're gonna hold that for 30 seconds, and then you'll swap to the other side and hold that side for 30 seconds. Like so. So you can do one leg at a time, but you can also do both legs at the same time. And a lot of times when you have SI pain, you also get low back pain. So doing these can also help with low back pain. And like that. Going directly from there, we'll do Piriformis Stretch. And I'm going to give you two different ways to do it. So the first one, you're going to cross. So say we're stretching the left side. Gear your knee to your armpit. And then, so left hand, left knee, right hand on your shin. And you're going to be pulling up and across. So you can pull like that, or you can even walk that right foot out and just let your leg fall, that right knee fall out. It's gonna pull that foot because it's gonna rotate your foot a little bit, and then it's less force through your arms. But again, you're gearing that knee to your opposite armpit, and you're gonna feel a pull in that left glute, left hip butt area. And you're gonna hold that for 30 seconds. So you can do a Piriformis stretch like that, but you know I like variety and modifications. Everyone's a little different. So option number 2 is a figure 4 stretch. And again, you're gonna cross that leg over, and then you're gonna raise that right leg up, hold your knee or the back of your thigh, and then use this left hand to push down on your knee, on that left knee. And again, you're gonna feel that into that glute hip area, holding for 30 seconds. And for these stretches, I would do 2 of them per muscle group. So I would do like 2 on the left side, 2 on the right side, go on to the next muscle group. Okay, so that is Piriformis Stretch. Going from there, we're gonna do some lumbar trunk rotations. And with this, you don't have to hold for 30 seconds because this is more of a mobility exercise, but you're gonna rock left and right, and you're gonna get a nice pull through your lateral abs and then to the other side. And this also provides nice, friendly, just movement to the spine. The spine likes to move. in friendly ways. So this is unloaded, it's slow and controlled. It isn't fast, you're not standing twisting under a bunch of weight. So it's nice and friendly. And this does really well for the SI pain as well as low back pain. It feels really nice. Okay, and then going from there, there's one more stretch that I find does really well. So you're gonna sit up, and it's gonna be a hip flexor stretch. So you can do this in standing, you can do it in half kneeling. There are many ways you can get to it, but I'm gonna do the one in half kneeling. So you're gonna prop one leg up into a half kneel. You're going to pelvic tilt forward, and then you're gonna lean forward. And you don't have to go far, but you're gonna feel this in the front of your hip. And you're gonna hold that for 30 seconds. Now you don't wanna be way like this and straining your back, okay? Make sure you pelvic tilt, tuck your butt under, and lean forward. And I already feel it there. So it's a lot less torque on the back, stretching that hip flexor. Okay. So those are the stretches I find do really well. So let's get into some strengthening as well. So we want to stabilize this joint and make the muscles that surround this joint nice and strong. So what you're gonna do to start is lay on your back again. And we're gonna go into a glute set. So your glute meaning your butt. And you're gonna squeeze your butt cheeks together, holding for about 5 seconds and then relaxing. So again, you're just contracting those big butt muscles. Squeeze them together like you got a $100 bill in there. Hold for 5, and then relax. And then I would do that 10 times. So just getting that glute activity firing. Okay. Going directly from there, we'll go into a bridge. What you're gonna do is squeeze your butt and then go up. If you find that you're getting low back pain or SI pain while you're doing this, activate your glutes, squeeze your butt muscles together before you go up, because you may be compensating and using your back muscles instead. Okay, so I would do this about 10 times, so you can do 2 rounds. Squeeze up and back down. Going from there, we're gonna work our adductors. So you can grab a ball, you can grab a pillow, you can grab a rolled up towel. I'm gonna use a foam roller, so really anything. There's lots of options you can use, but I'm gonna use a foam roller. And you're gonna put it between your knees. Like that. And you're going to squeeze in together on the foam roller, or the pillow, or the towel, whatever you decide to use, and then relax. So you can do it just like this, holding for about 5 seconds, and then relax. But you can also do a 2-for-1 and get a nice pelvic tilt. Activate your core. Think about drawing your belly button in towards your spine, flattening your spine against the floor, holding that transverse abdominis, that TA, that core muscle, and squeezing at the same time. So then you get a little bit of core and a little bit of adductor as well. So TA, brace, hold, squeeze, 5, 4, 3, 2, 1, relax. So again, we're just strengthening all the muscles that help support this joint. Okay. All right. We'll get rid of you. And then we're gonna go into our lateral hip muscles. So we're gonna be working more of our glute med, glute min. So you're gonna go onto your side. And the first thing we're gonna do is a clamshell. So think about keeping your hips rocked forward. We don't want them rocking back because that's gonna be more back. Hips are rocked forward and you're getting a sole rotation at the hip. You should feel it in the side of your hip right here. Holding just for a moment, controlled back down. So this is the clamshell. Okay, and as this gets easier, you can even put a band around your knees to make it harder, resistance. But I do 10 to 15 and do both sides. And then going from there, we'll do another glute med strengthening exercise. And you're going to straighten that top leg, bring it back just a little bit from your body, leading with your heel, going straight up towards the ceiling. You don't want to keep it way up here or rotate your foot up because that's going to be more quad and hip flexor, and we don't want that. We want more hip. So we're being very specific and have purpose behind the movements that we're doing. And up, and you should feel it right on the side, in that side butt muscle. Nice and controlled up and down. And again, to progress this, you can put an ankle weight around your ankle to make it harder. Like that. Now I'll do 10 to 15 on both sides. So those are some great exercises and stretches to help with your SI pain. As always, thank you guys for tuning in. If you found this video helpful, make sure to give it a like and check out my other videos where I post weekly content on staying strong, mobile, and pain-free. Thank you guys for tuning in, and I will see you in the next video.